My friends, this is Dr. B, the best doctor in medicine and the most handsome doctor in medicine. 30 plus years of clinical experience at high level in medicine. Today, Dr. B wants to talk to you about these new poisonous medications that have been approved and that more and more doctors have been prescribing for the last 2 or 3 years to people with diabetes. We call them these new poisons, right? SGLT2 inhibitors. Here they are, the most famous ones, right? Empagliflozin, dapagliflozin, right? Farxiga and Jardiance. My God, it is impossible to turn on your TV or your radio or any website on the internet without having an advertisement about SGLT2 inhibitors, also called SGLT2 blockers, Farxiga and Jardiance, empagliflozin, Jardiance, dapagliflozin, Farxiga. New medications that have been approved about 2 or 3 years ago. They went through clinical trials very quickly. They have been approved, of course, by the FDA very quickly because, as you know very well, the pharmaceutical industry makes billions and billions and billions and billions and billions of dollars, and are very happy to make that kind of money. And they are hand in hand with the FDA. The FDA approves their medications. Their medications are sold to you, and they make billions and billions of dollars of profit. Nobody knows what these medications will do to your brain in 10 years, in 20 years, or in 30 years from now. What is the effect of these medications in terms of chronic inflammation and dementia? Who the Katso knows, because they have been approved very quickly. They went through these clinical trials very quickly. They are extremely good medications to lower your glycemia, your fasting sugar. That's why they have been prescribed more and more, so that they can make a huge amount of profit, right? We have absolutely no clue, because there are new medications, what the Katsu's gonna happen to all these millions of people, not just here in the US, but in the entire world, who are taking these medications, right? Now, the reason I'm telling you this is that just yesterday, I have this patient, 65 years old, referred by her doctor to our beautiful cardiovascular clinic, where Dr. B works as an expert cardiovascular imaging expert. And I have to check her heart because she has type 2 diabetes. So, of course, how you doing, ma'am? And blah, 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 blah. So do you have high blood pressure, diabetes? Always the history taking, right? She tells me, of course, she has high blood pressure. She's on double medications. And she has diabetes. She was on metformin. And recently, her family doctor added one of these SGLT2 inhibitors, empagliflozin. Obviously, while I am talking to her, I can see that she's definitely overweight, if not obese. Remember that obesity is defined as a body mass index, BMI, at 30 or above. 30 or above. She's definitely overweight, or at least obese. And of course, I talk, nice lady with her husband, blah, blah, blah. And I ask her about, I always do that, right? What kind of, do you smoke? Do you drink alcohol? So she was drinking socially, not a smoker. And then it comes always to the question about what kind of exercise do you do? And not to my surprise, the only exercise she does is that after dinner every night with her husband, they take the dog to walk for half an hour to 1 hour. Now, and I asked her, do you go to the gym? Do you do anything else? Nothing. How is it possible that right now, September 2025, and I see that all the time, any adult, whether or not you have diabetes is not the point, or high blood pressure, how is it possible that an adult doesn't hit the gym, whether it's the regular gym outside, like the 24-hour fitness that I have very close to my place here in Mountain View, California, or the gym in my condominium, or the gym in my apartment. I have all the weights that I need to do my weightlifting and weight pushing. I have bars, I have everything. I have kettle weights, right? Kettle weights like this. I have dumbbells, I have bars, I have everything that I need if I don't want to go to my condominium's gym, to just do it in my own apartment while I can watch the news or do my work or study the Thai language, blah, 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 right? How is it possible that a woman who is 65 years young, right, who has diabetes, high blood pressure, doesn't do any other exercise than walking the dog every night after dinner between half an hour to 1 hour? How is it possible? It is crazy. You think that you're not going to see these people anymore, right? With all the huge amount of information that we have online, with all the medical knowledge and health guidelines that regular people have access to, how is it possible that nice couple, nice people like her and her husband do not have any other physical activity that every day, going walking the dog for half an hour to 1 hour after dinner? Guys, remember, walking the dog for half an hour to 1 hour after dinner every day is not going to do any katsu to your health, to your diabetes, to your blood pressure. Right? It's just not going to do any katsu. I mean, it's fun. It's good for your brain, right? It's good for the dog. You're going to meet the neighbors and other dogs at the doggy park, blah, blah, blah. You're going to talk. You're going to socialize. Very good. But it's just not going to do anything to you. It's not going to strengthen your bones, your muscles, your immune system, your brain. It's not going to make your diabetes go away, your belly fat. It's just not going to happen. Your blood pressure's not. I mean, it's better than just not doing it, right? A tiny bit of exercise like that is better than not doing it. But it's okay for somebody who is lean, for somebody who doesn't have high blood pressure, for somebody who doesn't have diabetes. Okay, be my guest and just don't exercise. Just go walk the dog half an hour to 1 hour every night. Okay, you have no diabetes, you have no high blood pressure, your glucose is normal, blah, 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 and you're nice and lean. Okay, good for you, right? But somebody like most Americans of a certain age who do have high blood pressure, diabetes, heart failure, kidney failures, this, that, obesity, being overweight, how is it possible that people do not go to the gym and do not exercise more than just half an hour to 1 hour walking the stupid dog after dinner, right? How is it possible? Now, in addition to these people that I see all the time, prescription of these medications gives people a false sense of reassurance. Means as long as there are these medications available, they will no longer make an effort to exercise, to zip their mouth. So she's going to eat the same thing. She was definitely, of course, not on diet after I asked her what you eat and blah. Just, she says healthy food, but the healthy food means a whole lot of fruits and vegetables with high sugar and pasta and rice and beans and bread and blah. You know what I'm saying? Because there's, everybody has a different notion of healthy food, right? When she says healthy food means she doesn't hit the Burger King every day. That's what she means by I'm eating healthy food, right? But me, I know what is healthy food. If I saw her diet, I would have a heart attack, right? That how can somebody who is 65, has diabetes and high blood pressure, eat that kind of garbage every day, which she calls healthy food? This reassurance, having these medications, right, makes these people no longer motivated to go hit the gym. That's the problem with this medication. In addition to that, there are potential poisons. Nobody knows what's going to happen to all these people who are now 40, 45, 35, 50. What's going to happen to their brain in 10 years, 20 years, or 30 years, right? Nobody, the Katsu, knows. Look online, go look at the list of medications that have been prescribed for the last 30 years and 40 years, and now more and more research, more and more studies come out and are telling people to not take them because they increase the risk of heart failure, inflammation, dementia, cancer, and blah, 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 right? The most famous ones are all these sleep medication, antidepressants, antipsychotic medications. Now psychologists and psychiatrists that have been prescribing these poison for sleeplessness, anxiety disorder, depression, blah, 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 for the last 30, 40 years, we are now realizing that all these people, young kids, teenagers, young adults that have been taking these poisons are now developing dementia. Another example is all these antispasmodic medications, right? That people, gastroenterologists and family doctors have been prescribing for decades for stomach cramps, right? Irritable bowel syndrome, right? All these anticholinergic medication, acetylcholine blockers, right? We are now finding out that they cause dementia, huge risk of increased risk of dementia. So we've been prescribing these poisons, right, for people who have stomach cramps, right? Irritable bowel syndrome, right? Because they block this contractility of your intestine. So they prevent your intestine from having these cramps. But at the same time, because acetylcholine is a neurotransmitter in your intestine, right? But it also a neurotransmitter in your brain. So by blocking with these nasty poisons, your cramps, the acetylcholine, right, in your intestine, you prevent cramps if you have irritable bowel syndrome, right? But at the same time, you block the acetylcholine in your brain. And acetylcholine is a major neurotransmitter. So after 20 years of taking these poisonous acetylcholine blockers, right? So-called antispasmodic blocker medications, now we found out they give dementia. I can go on and on through a huge list of medications that we've been prescribing for the last 40, 50 years, and just right now we find out that they are causing dementia. Look at all these children who are being given all these nasty poisons because they have hyperactivity disorder, right? Hyperactivity disorder, right? ADHD, right? They are giving all these antipsychotic medications, blah, 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 to little children. Well, because the kid has attention deficit hyperactivity disorder. When that kid's going to turn 50, he's going to have dementia because you're giving him all these poisons that mess up his brain, right? So be careful, guys, about these new medications that they give you for your high blood pressure, for your diabetes, for this, for that, for your irritable bowel syndrome. All these people who are taking these sugar substitutes, and even those who are taking these new natural stevia, right? Because they don't want to drink, like Dr. B, their coffee and their tea bitter, right? They don't want to put sugar because it's bad. They don't want to put honey into their tea and coffee because it's bad. And now they put all this sugar substitute, right? Xylitol, erythritol, blah, blah, that you find in all protein powders, right? And now, of course, that they have learned that they cause dementia and chronic inflammation, everybody has come out with this stevia. But the stevia is the same thing. Nobody knows what the katsu is going to do to your brain in 30 years. So why don't you drink your coffee and your tea bitter like Dr. B, right? Now, Has any family doctor or any doctor that is prescribing these SGLT2 inhibitors for people who have diabetes and who are overweight, if you would ask the patient how much time the doctor spent in the room telling you to exercise, to diet, and what you need to do, blah, blah, blah. Like I just explained to you, how long? It's been 15 minutes that I've been talking to you. Do you think that doctor spends the time to tell this kind of stuff that I just told you? To tell the patient, no, of course not. The doctor is busy seeing a lot of patients. He wants to make a lot of money to pay for his Lamborghini, his Ferrari, his mansion in Florida, his vacation home in Mexico. He's going to spend only 5 minutes of the patient. So it's with the patient. Official statistics of the American Medical Association, the average time a doctor spends with the patient inside the room is 5 minutes, while the patient waited an average time of 45 minutes in the waiting room to see the doctor. So for doctors, it's very easy. Oh, you have diabetes, ma'am. The metformin did not control it. I'm going to have to add this. And the doctor just going to say quickly, oh, you know what, well, make sure you exercise, make sure you diet. Oh, yeah, you're sure, doctor, I will do. And that's it. Get out of here. The doctor goes in the other room to make more money. 30 patients, 40 patients, 25 patients in a day, right? They see that's the average number of patients. Between 30 to 40 patients a day the doctor sees to pay for his huge lifestyle and his mistresses and ex-wife and blah, blah, blah. It's crazy. It is really, really crazy. So do not fall for this, right? Do not fall for this medication, whether you are a wife, a husband, if you have loved ones, right? Before any of you guys or your family member go on these medications, make sure you try natural ways. Shed the pounds, hit the gym, zip your mouth. It is not easy to do, but it's doable. Give yourself 6 months, right? And implement all this over 6 months. I swear to God, you're going to shed the pounds, your blood pressure going to disappear, your diabetes going to disappear. You won't have to take all these poisons that can potentially poison your brain and give you dementia, heart failure, chronic inflammation, all these nasty things that nobody knows what's going to happen because these are new medications, right? So be very careful. Go with the natural treatment. Zip your mouth, hit the gym, and of course exercise regularly, sleep at the same time every night. It is doable. Give yourself 6 months. No pain, no gain. But remember, once you reach, like Dr. B, the results, it is phenomenal. It is fantastic. I look at myself in the mirror. I have a big mirror in the shower, a big mirror in my bathroom, right? From top to bottom. My God, I love myself. I am nice and lean. It is doable. I am all muscle, skin and bone, no fat, 0% body fat. And you can do it too. It requires a little bit of willpower. Give yourself 6 months. But I swear to God, once you're going to look at yourself, and I'm 50 years young, right? I look 10 times, a million times better than most 20-year-olds. I look a million times better than all the kids in my family, most of whom are obese or overweight, my neighbors, my co-workers. I mean, it's unbelievable the number of obese, overweight people we have. 50% of American people are overweight. 30% are obese. Only 20% of American people are like Dr. B, right? Means nice and lean with absolutely no fat. Look at the results that you can get, guys. Look at this. Pay attention. Do you see this? This is Dr. B. Look at this. Do you see any fat? No, it's just skin. Look, no sagging skin, no fat, nothing. It's just skin, muscle, and bone. Look, do you see this? I hit the gym. Look at this. Look at. There's no sagging skin. There's no fat. Nothing. Same thing for my belly. Same thing for my ass. Same thing for my hip. Look at my chin. 50 years young. You're beautiful, right? And you can do it too. Buy some freaking weights, right? If you don't want to go to the gym, right? Buy dumbbells, buy barbells. I mean, it's doable. Do some crunches, do push-ups in your freaking apartment. You don't have to go anywhere if you don't want to go out, right? But you have to do it, and then go on the freaking keto diet. I swear to God, it will pay off. You will be just like Dr. B. When I look at, look at the pec. Can you hear the sound? Look. This is muscle, guys. Can you hear it? It's all freaking muscle. There's no freaking fat. I have pecs like a 20-year-old athlete. I have pecs. Pecs, beautiful pec, flat tummy. You can do it too. I swear to God, you can do it too. I love you guys, regardless of your gender, your ethnicity, your race, regardless of the color of your skin, your political orientation. I don't give a cazzo. If you're a Democrat or Republican, whoever the cazzo you are, I love you. Black, white, Latino, Muslim, Hinduist, Arab, atheist, Jewish, Christian. I don't give a cazzo. I love you. I give you a big hug. Put any question, comment you have down there. I promise I will get back to you in my busy but beautiful life. Hit the gym, zip your mouth, and go on diet. Keto diet. I love you. Bye-bye. Skop kunna krab, sawadee krab.